Hi, this is Cynthia Robertson presenting on emphysema, so let's get started. So emphysema is a chronic obstructive pulmonary disease. It's where the alveolar sacs inside the lungs are destroyed. There are holes in the walls of it that weaken the internal structure, which also decreases the airway elasticity of it. So the oxygen gets trapped inside the alveolar sacs. It's hard pushing the air back out. This means that the emphysemic patients are okay with breathing in, they just have a hard time pushing it out. Because the alveolar sacs are destroyed, it also decreases the blood gas exchange going on. They're not getting as much oxygen inside their blood, so they're not getting much energy. So the cause of it is any type of irritant inside of air that can destroy your alveolar sacs and that tissue inside there. Smoking is one of the main causes of it that health professionals see, or secondhand smoking as well. Genetics is also a very rare type of emphysemic cause. So you can tell you have emphysema because your nails start clubbing. So the pictures in the middle where the black person's nails are coming out in a round shape, that's called a clubbing nail. They also have a persistent cough. It's also called a smoker's cough. They also have wheezing, so it's hard to push air back out of their lungs. Their chest also tightens from how much they're trying to push out, which also causes dyspnea. And anxiety is also really bad for this because when they panic, because they can't breathe in and out, it also worsens the symptoms. So because they're having such a hard time breathing in and out, it causes a barrel chest type of situation to occur. So their lungs come out in like a circular shape and pushes against their rib cage, their barrel chest. They also have significant weight loss because they're not getting enough oxygen in. So since oxygen is one of the main ATP makers into the body. Okay? So since the ventilation rate goes up and cardiac output goes down, they get this pinkish on their skin, which got them the nickname pink puffers. So one of the testing is the pulmonary function test. The sign in the middle right here is going on a tube to a machine. The machine measures how much oxygen comes in and out of your lungs. And to actually get a positive PFT test for emphysema, your tidal volume goes way down, so you're not getting enough oxygen in, which makes the tidal volume. They also do a chest X-ray to see the type of situation your lungs are in. Or not. They also do an ABG test or an arterial blood gas to see how much oxygen and carbon dioxide you have inside your blood vessels. Some treatment for this are bronchodilators. What bronchodilators do are they take your bronchial tubes and they dilate them so it's not as hard to get oxygen in and out of your lungs. You can also stop smoking, which also decreases how much destruction is going on of your alveolar sacs. You can also purse your lips while breathing. So you do a 2 count in on inhale and a 4 count on exhale. This limits how much oxygen you breathe in, but it also gets more carbon dioxide out of your lungs. They also give you anti-inflammatories for any type of friction that goes on inside your lungs that can cause your lungs to hurt more. They can also give you antibiotics for any type of infection you might get while on it. You would also never give an emphysemic patient oxygen because an emphysemic patient, their lung system completely switches from the carbon dioxide and oxygen type to where they're more dependent on the carbon dioxide trying to get out than on oxygen. That is my presentation on emphysema. Thank you very much.